Chapter review. Medicine has a language of its own. As an EMT, you will frequently communicate with medical professionals who speak this language. Medical terms generally consist of a root with a prefix and a suffix. Are my medical terms accurate and descriptive? These are key decisions. Are my medical terms accurate and descriptive? Do I understand when and when not to use medical terminology? Can I identify by direction the area where a patient has a complaint or traumatic injury? Can I identify the position a patient is in when found, or the position in which the patient will be placed? Chapter glossary. These are going over words that we have already run into. Abdominal quadrants, 4 divisions of the abdomen used to pinpoint the location of a pain or injury. The right upper quadrant, RUQ. The left upper quadrant, LUQ. The lower right quadrant, RLQ, and the left lower quadrant, LLQ. Anatomic position, the standard reference position for the body in the study of anatomy. In this position, the body is standing erect, facing the observer, with arms down at the sides and the palms of the hands forward. Anatomy, the study of bone structure. Anterior, the front of the body, or body part. Bilateral, on both sides. Combining form, a root word with an added vowel that can be joined with other words, roots, or suffixes to form a new word. For example, the combining form thermo added to meter makes the word thermometer. Compound, a word formed from 2 or more whole words. For example, the compound smallpox formed from small and pox. Distal, farther away from the torso. See also proximal. Dorsal, referring to the back of the body or the back of the hand or foot. A synonym for posterior. Fowler position, a sitting position. Inferior, away from the head, usually compared with another structure that is closer to the head. For example, the lips are inferior to the nose. Lateral, to the side, away from the midline of the body. Medial, toward the midline of the body. Mid-axillary line, a line drawn vertically from the middle of the armpit to the ankle. Mid-clavicular line, the line through the center of each clavicle or collarbone. Midline, an imaginary line drawn down the center of the body, dividing it into right and left halves. Palmar, referring to the palm of the hand. Physiology, the study of body function. Plane, a flat surface formed when slicing through a solid object. Plantar, referring to the sole of the foot. Posterior, the back of the body or body part. Prefix, a word part added to the beginning of a root or word to modify or qualify its meaning. For example, the prefix bi added to the word lateral forms the word bilateral. Prone, lying down. Proximal, closer to the torso. See also distal. Recovery position, lying on the side, also called lateral recumbent position. Root, the foundation of a word that is not a word, but that is not a word that can stand on its own. For example, the root cardi, meaning heart, in words such as cardiac and cardiology, but you would never see cardi on its own. Suffix, a word part added to the end of a root or added to the end of a word to complete its meaning. For example, the suffix itis added to the root larynx forms the word laryngitis. Superior, toward the head. For example, the chest is superior to the abdomen. Supine, lying on the back. Torso, the trunk of the body, or the body without the head and the extremities. Unilateral, limited to one side. Ventral, referring to the front of the body, a synonym for anterior. So a synonym means that anterior and ventral mean the same thing. Preparation for your examination and practice. Short answer. Define the following pairs of anatomic terms: medial, anterior, proximal, lateral, posterior, distal. 2. List 2 prefixes that mean below. List 2 suffixes that mean pertaining to. Describe the difference between the prone and the supine positions. Describe the anatomic location of the mid-axillary line. 6. Describe how the abdomen is divided into quadrants. What does the term pulmar refer to? Thinking and linking. Linking your knowledge of medical terminology and anatomy with common diseases will help you to understand the diseases and communicate about them. For each of the following diseases, use word parts, root, prefix, suffix as appropriate to determine what organs the disease affects. Refer to Table 5.1 and the discussion under the components of medical terms for assistance. Gastritis, neurology, hepatitis, postnasal, tachycardia, bradypnea, neuritis. Okay, here's the critical thinking exercise. Understanding medical terminology and knowing how to use it is important in your practice as an EMT. The purpose of this exercise will be to consider how you might appropriately use medical terminology in your radio report about a patient's injuries. Here's the first case. As an EMT, you are called to respond to a teenage boy who has taken a hard fall from his dirt bike. He has a deep gash on the outside of his left arm, about halfway between the shoulder and the elbow, and another on the inside of his right arm, just above the wrist. His left leg is bent at a funny angle, about halfway between hip and knee, and when you cut away his pants leg, you see a bone sticking out of a wound on the front side. You take the necessary on-scene assessment and care steps and are on the way to the hospital in the ambulance. How do you describe your patient's injuries over the radio to the hospital staff? Okay, down here, street scenes. Okay. Unit 114, respond to a motor vehicle crash. Multiple vehicles at the intersection of Route 690 and 81. Be advised you will be reporting to 81 Command. You and your partner are excited to finally be called to this crash, as you've been listening to multiple other ambulances responding to what seems to be a big multi-casualty scene. You switch on the emergency lights and travel to the scene. Unit 144 to 81 Command, where do you want us? Your partner asks over the radio as you pull up. Your heart beats just a little faster as you see for the first time the debris and severe damage of what appears to be several wrecked cars strewn across the highway. Command to 144, pull up behind the rescue. You will be reporting to the treatment area. Your partner stays with the unit as you briskly walk to an area marked with a red tarp. You are met with a familiar face dressed in a vest that reads "Treatment" in bold letters. She points to a patient lying on a backboard and gives you the following report. 46-year-old male driver of car 3. High speed, severe damage to the car. Patient complains of dyspnea. Secondary triage noted medial tenderness to the chest wall and pain in the upper left quadrant of the abdomen. He also has a proximal humerus fracture and bilateral tibia fibula fractures. He's all yours. Here are the street scene questions. Number 1. As you assess your patient, how does a knowledge of medical terminology impact your process? Specifically, where does this patient's chest hurt? Would pain in the upper left quadrant of the abdomen be located above or below the belly button? 4. What part of the humerus is broken? Where would the fracture be located? You begin a more comprehensive assessment. Your primary assessment finds the patient to have shortness of breath but adequate breathing. When you listen to his chest, you hear lung sounds on only one side. You also find a penetrating wound in the patient's armpit on the left side of his chest. You seal the wound and immediately let the treatment officer know that you will need advanced life support, ALS. As you continue your assessment, a paramedic comes over. Here are the street scene questions. Number 5. Use medical terminology to describe to the paramedic the location of the penetrating wound. 6. What term would be useful in describing lung sounds heard on only one side of the chest? The paramedic quickly checks the penetrating wound and finds that you have already sealed it with an occlusive dressing. He listens to the chest while you assess a blood pressure, 72/40.